Well, hello everyone, and welcome to what we do hope is a lively discussion on health as it relates to the health and safety profession. And in fact, I do say do hope. I could say that I have only met David once prior. And in fact, in that first conversation, we had an incredibly lively discussion and a fear that we could have actually probably ended up doing a podcast series for so much that we had to talk about. But so my name is Genevieve Hawkins. I have a long-term background in health, having originally started as an occupational therapist and have been in the health and safety profession and then beyond. And also the author of Mentally at Work. So very much the health and well-being of people at work is an incredible passion of mine. And I'm incredibly lucky to be here with David Beaumont. And David, I would love actually to kick off with you introducing yourself to the audience, if you may.
Thank you, Genevieve. And I'm really excited for the podcast series we're going to do. And actually, we did say afterwards that we should have recorded that first discussion that we had, because that would have been good enough for any audience.
Absolutely.
Yeah, but yeah, I'm an occupational physician, a doctor who specializes in the health of workers, their families, and their communities. And I've added those last sections only this year as I've realized the impact that we can have when we focus on health in the workplace. And that is my focus. I'm based on South Island, New Zealand, just outside the beautiful Queenstown. And I work with some of New Zealand's major employers. And just at the moment, we're being challenged by making sure that we're prepared to keep workers safe in the ever-changing world that we live in at the moment.
I love it. In fact, I just realised we could actually also have a podcast on the South Island of New Zealand, because that's one of my favourite places to go. But I'd love to start, David, with well, in fact, I might actually do a reflection first before I ask you a question, because when I was reading the chapter, the thing that I absolutely loved in reading it was this shift of definition of health. And understanding that move from health as an absence of disease to health really as living, isn't it? Like making the most of your life and understanding that. And so I'd love just to perhaps get you to give a reflection. And I know this is completely going off script, but would love you to get that sort of reflection yourself on what do you think is causing us to rethink what health really is all about?
Thank you, Genevieve, for going off script. Question.
Right at the beginning.
Yeah. Well, the fact is that I've been 40 years in medicine now. And my own view of health has changed enormously over that time. I was taught that medicine is a science and that health is the absence of disease. Medicine is not a science, it's an art. Mm-hmm. Health is not the absence of disease, it is so much bigger than that. And I think that's well worthwhile exploring.
Yep, I love that. So then does that perhaps link into a question of why you decided that you would love to write this chapter for the profession?
Yeah, I was thrilled when Pam Pryor approached me and asked me to write the chapter. And I know I'd been recommended to her by a mutual colleague and friend of ours. And he recommended me because I'm a bit of a disruptor. I have a bit of a reputation. But I'm a positive disruptor. And that word is really important, because along my journey, I've realized that the focus of medicine is a very negative focus. And actually, that also applies to occupational health and safety. The focus has been work is harmful, let's protect workers. And just over 10 years ago, I led a project of the Royal Australasian College of Physicians. The project was initially called Realizing the Health Benefits of Work. And when I started presenting on that subject, the health benefits of work, people would laugh in the audience. And they weren't laughing at me, they thought they were laughing with me because they thought I was making a joke. how could work be good for health? And that was only 10 years ago. And actually what we're now realizing is that good work is good for health. And good work is an integral part of what makes a good life. So the opportunity to actually provide my reasoning for that statement was just too good to miss. And I loved writing the chapter, and I loved working with Pam on developing it into something that is provocative, thought-provoking, and hopefully adds to the evolution of OHS.
And so it's quite interesting, actually, David, that you are saying this, because I've had maybe it's an aha moment or something along the line, I'm not too sure, but as an occupational therapist, and so, I mean, many people come to the health and safety profession, or in fact, from a variety of different avenues to land in the profession. But my background is an occupational therapist. So right from my undergrad training, which was a number of decades ago, actually, we understood a sense of the value of work. But in the context of therapy, of saying we've actually, as OTs, we're trying to get people back to a whole life. And so therefore work is an integral part of it. But it is interesting when I then reflect on the way that I then learnt health and safety or studied that at university at a postgraduate level. And it was very much about how do you have an absence of disease or absence of illness? So how do you prevent certain things as compared to optimize health, which is clearly, one of those key drivers for you. So I really love that, as saying this is how we continue to expand that conversation across a whole range of different professions, but absolutely into the health and safety profession. So when you finished the book and you were thinking about, it's out there for the health and safety profession to read, what in your mind do you think were the key messages that you were hoping the profession would, I guess, sense from reading the chapter?
Yeah, I think if I was to pick three concepts that thread their way through the whole chapter, they would be that the definition of health has evolved, the role of the OHS professional has evolved, and what people expect from work and their lives has evolved too. And that latter point, I think, is incredibly important, because back to having my doctor hat on, people are dissatisfied with what they're getting from their doctors, and they are craving health and well-being. Personal development, health and well-being. How do I achieve the best out of my life? How do I achieve the best out of my work? How does work contribute to my life? Is a question that people are increasingly asking themselves, and they are asking of their employer. And never has that been more true than the last 2 years, as we've been going through a pandemic and people have been reevaluating their lives.
And so there's an interesting thing there, isn't it, so we often have, or say often, if I look across different organisations, you'll have some people who are health and safety professionals in roles that are called health, safety and wellbeing. And so that kind of is together. We've obviously, for not forever and a day, but for a long time have been called health and safety professionals, but that health has been far more focused again on that absence of disease rather than actually creating a really good overall well-being for people. And there are times where organisations almost have a split. And so you can have well-being managers, or what it might be, that may or may not actually sit with a health and safety professional. They may sit in a different kind of bucket. And dare I say it, we have the risk of, we're doing wellbeing programs because we have Fruit and Fridays and we offer yoga classes. So I'm kind of interested in your reflections on what you think are the biggest challenges for the health and safety profession in grappling with this idea that if you are in this profession, you kind of really need to understand this new and evolving way of thinking about health.
Goodness, that was a big question.
Shorten question. Challenges. What are the challenges of the profession?
You touched on several issues that I really would like to probe further. One is that going back 10 years in the workplace, my experience was that occupational health and safety, well-being, injury management, sickness absence management were all completely separate, often under different departments within large organizations. Ne'er the twain shall meet kind of thing. No interrelationship. So I think that the evolution of occupational health and safety and well-being is the right direction. The question becomes, are we getting it right? And is this just a convenient place to put well-being? And I don't know the answer to that. You also touched on doing well-being as being the bowl of fruit once a week and yoga classes and here's free gym membership. And of course, the people who go to the gym already say, wow, this is great, free gym membership. And the people who don't belong to a gym don't take it up. And really, really good evidence that health and well-being programs in the workplace don't work. Full stop. I know, heresy.
Well, it is.
But let me finish, because there's also really good evidence that health and well-being programs in the workplace would give a return on investment of 3 to 1. $3 back in increased productivity for every $1 spent. So there is hugely conflicting evidence, which challenged me for a while until I realized why that is. And the answer is you can't do health and well-being to workers. You have got to provide health and well-being for workers, but it has to be against a culture of health and a culture of workers feeling valued and respected.
Oh, there is so much in that. So much in that. Because I think then that's this is me with my I've got little sticky notes underneath here that I'm just scribbling as I listen to your responses.
I loved that you needed to write that down. Yeah. I knew I dropped a goodie when you did that.
Well, it's interesting because I just think, like I've seen, I think again of even my own journey in the profession and where it kind of traditionally started around these concepts of understand hazards. So what are all of these key groups of hazards? And for each of those hazards, how do you assess the risk and how do you, what are your most effective ways of controlling, which is often taught the way that risk management often is sadly taught, which is about minimizing problem rather than optimizing the opportunity. So that's kind of, I think, part of the challenge for the profession is the past way in which we've understood risk and managed risk within it. But we've gone from, we get specific hazards and how to manage them to this idea of systems, but systems really more from a management systems perspective. So what are the processes and, the policies, et cetera, that we have are overarching that help to frame up how we do things. And then there's this thing called culture. And I've certainly seen an explosion over the last probably decade or so of more and more people going out saying, we'll help you with your safety culture. And let's look at it in terms of the concept of how we lead in safety. But I don't know that I've really ever heard the health and safety profession talking about a culture of health. So that's a really interesting challenge to start getting in under. And I'm curious on one of the challenges here too on how do you think about so I think about mental health and conversations around how we train leaders to engage with teams. And it's often, again, on that managing risk issues rather than optimizing. But I often hear the comment that leaders will go, but I'm not a mental health expert, so I don't know, what to say. And we go, it's okay. It's not about knowing all the technical things. It's about how you connect with people, etc. But if someone turns to the health and safety profession and you go, well, you're the professional here, then I expect you to have some level of understanding and experience in that space. So is that kind of going to be a challenge for us in the profession, where some of us have come from a health background prior, and so there's probably an easier blending of I've got a grounding in health and I've got this grounding in safety, but there's others that haven't. So how do we help people who've gone, well, actually, I've got a technical background in health and safety, but really it's actually about trying to prevent disease rather than optimizing health. Where would they start?
Yeah, and you're right. Some OHS professionals have started out in occupational therapy or physiotherapy or occupational health nursing, gone down the health and safety route, and now adding on well-being, and that fits well with somebody from a health background. I think the key thing actually is to have a framework to work to. And the chapter is actually very much about providing frameworks. It's a very theoretical chapter, but it's written in a way that the theory can be applied in practice. And one thing I just want to pick up on, though, is this. Probably 8 years ago, I did a keynote presentation called Mental Health in the Workplace, the Next Big Thing. And I started talking about mental health in the workplace. And I actually was prophetic in saying it's going to be the next big thing. But I actually did it in a challenging way. And I said, oh, okay, what do we mean when we talk about mental health in the workplace? We mean anxiety, depression, work-related stress, challenges outside. Why is the expression mental health perceived in a negative connotation? What about the positive connotation of mental health? And this leads me on to the framework. And the framework is that there are 3 levels of disease prevention. And it applies to physical health as well as mental health. And those are primary, secondary, and tertiary. Primary prevention, and let's stick with mental health. Primary prevention in mental health means you've got good, healthy mental health, and you want to stay that way. And in fact, you want to build on that. You want to both survive and thrive and get the most out of life. Secondary prevention in mental health is things are falling off the rails a bit. And I'm struggling a bit. I've got a lot of challenges at work, at home, in my life in general. I'm mid-career and I might not have achieved what I thought I was going to. And I'm a bit overwhelmed by everything going on. I want strategies to be able to tackle that and actually get my life back on track. Tertiary prevention is the wheels have fallen off. And I've got anxiety, depression, work-related stress. Now, this is traditionally when we talk about mental health, this is the tier we're talking about. What I'm saying is actually we need to pick that up. We need to prevent at the secondary level. We need to do early intervention. But let's also have a focus on primary prevention. Let's use the arena that is the workplace to actually improve people's mental health, to actually give them strategies, not only to use at work, but to use at home and within their communities. And this is where the whole of life picture starts to come in, and seeing people not just as workers, but as people with jobs and roles at work, but roles at home as well, and families and communities that they have roles in as well. So this is the whole person view of health.
And David, I just want to keep asking lots of questions here, but but I'm keen just on that one in thinking about this idea of absolutely whole person, and I'm loving all this conversation, particularly around this whole idea of how people, I think, incorrectly use the term mental health, to your point. And I often sort of talk about just replace mental with physical health and see whether that sentence makes sense on things, because if it makes sense for physical health, we should be thinking mental health in the same context as we say physical health. But I'm interested in, there's this part, I guess you're talking about from a health point of view, of the whole person and understanding the whole person in order to be able to optimize their health. But if I'm a health and safety professional I'm employed by the organisation to look at organisationally, what do we do? How do you help to guide the profession on the balance between what is an individual responsibility for their health and their choices that they make, and what it is that the organisation should be thinking about in that primary prevention space?
Yeah. You used the R word there, responsibility, and I think that's massively important. Where it comes to ill health, there is the way we've been taught to respond to our own ill health is to go to see a doctor and give the doctor the problem and expect to be fixed. That's one of the major problems with our healthcare system. But actually, who is responsible for our own health? We are. And we actually have the ability to make choices that impact on our health. The same applies in the workplace. And I actually think that not enough is being done to make it really clear to workers that their health and safety at work is just as much their responsibility as it is their employers. It's a shared responsibility. And as soon as we start doing that, then if it is a shared responsibility, then we must share the solutions as well. We must share the problem, share the solutions. Let's work collaboratively to find what the solutions are. Now, as an OHS professional, then your training is to identify the problems and identify the solutions. But here you've got partners in the workplace who can work with you collaboratively to come up with joint solutions that people feel they've got ownership of. And this is the problem with both health and safety and well-being being done to people. They have no ownership. They don't respect it. They don't trust the employer. And this is actually where they stop feeling valued. And what do they do when they stop feeling valued? They pull back on discretionary effort. And this is where the link between well-being and productivity comes in. It's all down to discretionary effort. But as soon as you've got a disgruntled employee who's not happy, doesn't feel valued, is holding back discretionary effort, they are more at risk of having accidents. And if they go off work with a lost time accident, what's the incentive to rush back to work? They haven't got one. This is the group that stay off work longer. And this is the group where the biopsychosocial model comes into play. That the factors that keep them off work might be in part biological or physical, but the psychological factors start to creep in, and the social factors, particularly the work-related social factors, become predominant. So this is why actually engaging with the workforce, making them feel valued, respected, seen for who they are, and we can apply that just as much to groups of workers as we can to individual workers, suddenly there is a winning recipe.
I love it. Because really what this chapter I see is challenging people to think about is that definition, we've moved in our thinking, and the research shows that we need to shift from health as an absence of a disease to health as that ability to effectively control our lives and optimize our lives. And actually what we're asking the profession to think about is, therefore, how can your role shift? And so that your role is not just about helping the organisation to stop from having an injury or illness, but it's actually to help optimise the health of the people within this organisation so that they can actually provide the best contribution to that organisation. So, David, what would you hope then for people to be curious about now that they've listened to us and recognised that we really could go on for many hours about all sorts of different aspects of this idea of health in the workplace? What would you like them to get curious about?
Great. Well, there's an obvious answer leading on from what you were just saying, which is, how could all of this impact on my role? what I do as part of my role, but also how I am seen by the organization, the impact I can have on this organization, which is not just about preventing accidents. It's actually, my role is linked directly to productivity. My role counts, my role is valuable. The second suggestion that occurs to me, be curious about how this affects the workers. And when I use the word workers, I want to remind everyone that the workers include the board, the senior leadership team, every tier of management, every tier of the workforce, and the OHS professional themselves. How does this affect every single tier of the organization? Because if health and well-being is good enough for the shop floor, it's good enough for the board. I actually think it should start at the board. And I think the board should say, we've been on this program and it helped us in the following ways. And then the third thing that I would love the readers of this chapter to be curious about is, oh my goodness, what does all of this mean for me and my health and the fulfillment that I get from my life and my role within my family and my community? And what does it all mean? And actually, I take health and well-being to the extension of, it also includes what brings meaning and purpose into my life. Why are we here? So it ties in with the big questions. So if it causes readers to stop, to pause, reflect, then I think there are some really good insights and aha moments to be had.
David, I feel like I could just break into song at the moment, just listening to that, because I love that. I was reflecting on a conversation that I had recently with an organisation who was asking for some help, and they said, we want our team to feel like they belong, and we want you to spend some time with our leaders to help them in how they help their team to belong. And the question that I turned around and asked was, do the leaders belong? And they kind of looked at me going, what are you asking? And I said, well, if as an individual, I don't feel like I belong, then how on earth can I create a sense of belonging for others? So if we want to actually shift this, we need to shift ourselves first. And I think that's that really great reflection into it, to then really go, how do you start with yourself? And how do you have that sense, am I healthy? Am I absolutely creating the most of who I am and where I'm at and what's going on for me? And then how does that flow out to my role and then to what we do in the organisation? And I'm conscious this is a huge topic. I would like to think, hopefully, having listened to this conversation, that people are actually curious enough to absolutely want to pick up and read this chapter on health. I'd really, really encourage it. I think it's really interesting to understand some of the research behind why it is that we've learned over time how we need to shift our thinking around this space. But it's not like you can read a chapter and have absolutely every answer there in front of you for what needs to happen moving forward. So it's really important as a profession that we really continue this conversation. What does it mean for me as an individual and my own health? What does it mean for me in my own role in my organisation? And how can I help our continued conversation as we then go, how do we develop the profession to help support organisations in such an important topic? So, David, thank you so much for the conversation. It's been delightful. I would like to think that we could have many more conversations. I look forward to them, and hope said that this sparks curiosity for everyone for the journey that we face as a profession. So, thank you.
Thank you, Genevieve. It's been a pleasure to be part of this.